If I treat my acoustic neuroma with radiosurgery, how long will it take the tumor to respond to the radiation and stop growing?
So this is a good question in terms of setting patient expectations, which is if I have radiosurgery for my tumor, what's the expectation? When can I feel comfortable that the tumor is dead and not have to worry about it? So we know for benign tumors such as acoustic neuromas that radiation can take several years to completely kill the tumor. And that's just the nature of benign tumors. So malignant, fast-growing cancerous tumors die very quickly from radiation. Benign, slow-growing tumors such as acoustic neuromas die slowly from radiation. And this kind of duration of 2 to 3 years is potentially one reason to consider treating earlier rather than later if you're considering radiation. You have to factor in this 3-year window in which the tumor will need to have to die from the radiation. And this same reason for why there is this 3-year, what we call latent period, is why patients that are symptomatic from their acoustic neuromas are often recommended to have surgical resection if we don't think the patient can make it 3 years based on their symptoms. So again, a 2 to 3 year time frame is typical to expect following radiation for your tumor to say the tumor is dead. And even after 3 years, we can't say with 100% certainty, but there's near certainty. It's very unusual for tumor progression after 3 years. During this period of time, we obtain MRI scans to ensure that the tumor is stable and not growing. And we've already talked about in one of the previous questions that tumors, as they undergo their dying process, can release inflammatory factors that can cause swelling of the tumor. And this swelling may manifest as either a slight plumpness or increase in size on the MRI scan, or it could also manifest as some fluctuation in the patient's symptoms. And typically we would expect this within 2 years of the radiation treatment. Once the tumor completely dies at the 3-year mark, the swelling is dissipated, and we do not expect any potential flare-up of symptoms related to swelling.